today we are indeed proud to have with us Dr. Vikas Taneja, who is HOD Pediatrics, Manipal Hospital. Now, what to say about Sir? I think its association with Sir is almost a decade. Part of ITN. He's part of ITN, and somebody told Ritu ma'am, you introduce an ITN. I don't have to write Sir, and I don't have to see because I can virtually count all those years that we've always seen you associated with school, taking a larger view, be it the COVID situation when our students really required, our parents, our students, our teachers really required. Sir has always been there. We have a 3 a.m. friend. Sir is that kind of 3 a.m. friend who has been always there for ITN. I remember when we were making our school free from disease or to be safe for COVID, Sir was actively participant. He with his team was there in school, going in each class, taking around everywhere and all the corridor to see. Sir has been a part of the school, he's been part of PTA body member, and now he's a part of our SMC. A long journey, but with Sir, we have always grown. And the kind of interaction which you'll all see, it is not somebody coming from outside and giving a session, it is that he means welfare for each one of us. I think I don't have to see paper. A lot of things were written. We have students coming up with stomach aches, eye flu. Had it been 2 months back, we would have said it is just a fraud excuse. But now, with the rains and everything, with students failing their stomach infection and all that, and typhoid cases rising, and the Sir is the right person to give us an inroad to as to how to cure it and how to take all possible prevention to keep ourselves hale and hearty, fit and fine. Over to you, Sir. With this, may I request, Sir, just 1 minute? May I request, ma'am, to kindly welcome Sir with a planter. The students, you just saw, even if you goof up somewhere, this is the way to solve it. Thank you, sir. Thank you, ma'am. Over to you, sir.
Okay. Good morning, everyone.
Morning, sir.
So, why are we all here? You all have to interact. Otherwise, there is no point sitting here and just hearing. You will listen something and then you will go off and everything will be gone. Why are we here? So why are we talking about all these things? Why are we talking of various types of diseases in today's times? I just be very brief. See, I think time does a lot of things, right? Times are changing, technology is changing. Next slide. Have you seen these old type of phones?
Yes.
Yeah?
Yes, sir.
And which is the latest brand of mobile phone going on these days? iPhone. Which iPhone? 14. 14 or 14 plus?
15 आ गया अब तो
15 भी आ गया. Who all of out of all the students who all are on Instagram? Everyone. Technology is picked up like this, right or wrong? So you are aware of all the latest things. Who's the latest singer going on these days? किसके गाने सबसे अच्छे लगे? English, Hindi, Punjabi, dance sequences, or Korean serials. Yes. So you people are, so we all are aware of the latest thing going in the market. We want to enjoy, but remember, next slide. The past have also evolved. How many of you If I ask in this room, suppose you get a problem today, you have high fever, what needs to be done? Now,
Dolo, Dolo,
fever आ गया? हाँ,
Dolo.
rest and medicine. What type of infection it is? Do you know? So, what is viral? If you have both media, is it a virus? If you are getting very high fever, can it be dengue?
No.
Have you heard of dengue?
Yes,
Have you
sir.
heard of malaria?
Yes, sir.
What is dengue? Can anybody? You have some idea कि dengue क्या होता है? Anybody can. So my focus now is at least we should all be available day to day, and you should know what needs to be done. The same way, if you need to enjoy a good life, you need to enjoy your films, you need to enjoy your music, you need to play, you need to do whatever activities you want to do. You want to come to school, you want to study. You need to take care of yourself. You have to understand the diseases also. That's what I said, that COVID has at least made us all aware that nobody is safe from diseases. You cannot say, I don't have a problem, I have never had a fever, or I have never had a severe disease, I cannot have it. Each and every can get an infection which can be very, very, very severe. And there are reasons for it. So we will discuss. But first and foremost, I'll just briefly cover, because the topic for today is monsoon related disease. What all diseases happen during this period? Anybody of you can stand up and say what all diseases happen during this period of this season, particularly in our country? Viral fevers, diarrhea, typhoid. You are seeing typhoid, dengue,
Malaria.
malaria, right? So there are a lot many diseases, and it is it is not easy to differentiate one from the other. But you need to understand कौन सी disease कैसे आती है, क्यों आती है. So briefly, I want to so why do this spread in the is very important. If you look at it, extremes will not see the drop, but the problem is this is the time when people viruses just explode in the environment. Then a good amount of moisture is lot of humidity. So this is the environment for viral bacteria to grow. This is the time when our body immunity is slightly on the lower side. Okay. And the fourth biggest problem that we see in especially in our country is misuse, overuse of antibiotics. Left, right, and center. For every small thing, an antibiotic pill is popped up. डॉक्टर के पास जाने की क्या जरूरत है? Just go to the chemist. पेट खराब है, he will give you an antibiotic. You take it, you will find it 2 to 3 days. But this causes a vicious cycle, and you start getting more and more infection. So that is why this period, particularly, we should all be aware what types of infections happen, how they come. Okay. So how does dengue spread? Mosquito bite. How does typhoid happen? Good. I think you still have some idea, right, please? So it was very, very correctly mentioned. Ounce of prevention is worth a pound of cure. So if you have a disease, definitely not But if you are to prevent it, when you follow the instructions, you will be much, much better off. Okay. So we need to be aware of what all diseases can happen, how they spread, what is the time, what will be the signs and symptoms, how it is treated. You should have some idea about it. You don't need to know the complete details, but you need to have some idea कौन सी infection कैसे आती है. Okay. So I have tried to simplify it for everyone to learn. Okay. Next slide, please. So monsoon related diseases can be divided into three parts. One is vector borne. Vector borne means one particular vector is there which transmits the disease, like mosquito. Mosquito bite, mosquito becomes infected with the virus, and then once it bites the other person, the virus travels from one person to the other. So these are called as vector borne disease. So this includes your dengue fever, malaria, chikungunya. These are the infections which we see. Then there are waterborne disease, which happens through contaminated food and water. So here comes your typhoid, hepatitis, gastroenteritis, or you can say diarrhea, vomiting, cholera, leptospirosis. So these are the common waterborne diseases in our part of the country, especially in North India. We see a lot of them. And third is airborne disease, which spread through droplet infection. So if you cough, you sneeze. So if you sneeze, then a lot of droplets come out, and these droplets carry the viruses or the bacteria. So COVID was an example of a airborne. Similarly, in monsoons, we see common cold, flu, influenza. These are the common diseases which we see. So these list more or less is complete, which gives you an idea what all types of diseases can happen during this season. Right? Next slide. So we will cover each and every disease in a very, very simple form. Okay. So first is vector-borne disease. I have specifically started from dengue because this season, and especially in Delhi, we all need to be aware about dengue. So dengue, again, understand, is a virus. Okay, before going on to this, I'll just briefly summarize. When we say this is a viral infection or this is a bacterial infection, what do you understand by it? Not from a medical perspective. वायरस है या बैक्टीरिया है उससे क्या फर्क पड़ रहा है इन्फेक्शन इन्फेक्शन
they translate the viruses adapt or something and by time as the bacteria they fix with them. So and bacteria can be
no viruses also adapt bacteria also adapt so viruses understand viral infection usually have no treatment simple समझने वाली चीज है there are no antiviral drugs which can cure a particular virus है भी तो बहुत limited है bacterial infections require antibiotics okay अगर बैक्टीरियल इन्फेक्शन है और आपको एंटीबायोटिक नहीं खाओगे वो नहीं ठीक होगी वो वर्स होगी अगर वायरल इन्फेक्शन है आप एंटीबायोटिक खाओगे वो कुछ नहीं करेगी बिकॉज एंटीबायोटिक कैन नॉट किल द वायरस इट कैन ओनली किल द बैक्टीरिया नाउ इफ इन अ वायरल इन्फेक्शन इफ यू टेक एन एंटीबायोटिक व्हाट विल हैपन
So many of the good cells will begin to die.
yes so antibiotics do not have eyes it kills the bacteria whether it is good or bad so it kills all the good bacteria of the body so good bacteria are required for your immunity so if your good bacteria are constantly washed out what will happen your body immunity is low so now you tend to get more infections and more infections will be more viruses because virus के लिए कोई drug है नहीं antibiotics bacterial infections नहीं आएंगी but viral infections परेशान so why we need to understand is now suppose we talk about dengue so dengue is a virus vector-borne disease spreads by a mosquito the mosquito is called as Aedes aegypti mosquito so you hear a lot government or बहुत सारी information so it is called as a tiger mosquito why so it is striped It is a day mosquito. It breeds on stagnant water. So why all these things are important? We will come into that. So जहां भी पानी इकट्ठा हुआ है, especially in rainy season, you see spots जहां पर water logging है. So these are the breeding places for mosquitoes. Dengue virus is, so why we are mentioning 4 types is because anyone can get infected with a particular strain of dengue virus. So अगर 4 types हैं तो किसी भी इंसान को 4 बार डेंगू हो सकता है उसके लाइफ में. If you get infected by a particular virus, then your body develops antibodies against that particular. So that virus will not. So if suppose you are getting repeated fevers and somebody says कि बार-बार viral infections हो रही हैं, it is not the same virus. Every time it is some new virus, some which can be diagnosed, some which cannot be diagnosed. So we just follow the pattern of the disease. So viral infections we say usually are self-limiting. So 1 day, 2 days, 3 days, 4 days of fever. Most of the viral infections will cause headache, body aches, running of eyes, sneezing, malaise. You will not want to eat anything, feeling nauseated. Day 1, very, very high fever. Day 2, day 3, fever intensity starts reducing. In between, you start feeling a little better. Day 4, 5, most of the, so if you don't have a diagnosis, किस तरह का infection है, then we need to follow that. That is why in children, particularly, we don't do much investigation. We first know the pattern of fever because maximum infection will be viral. So if they are viral infections, they need to know in 4-5 days. If they don't settle, then we investigate and find out the cause. Okay. Now, why is dengue important? Dengue is important because this virus again behaves like a normal virus for first 4 to 5 days. Then the problems start. Fever, 2 days, 3 days, 4 days, cough cold, body aches, 4th, 5th day, everything settled. 6th, 7th day, you are normal feeding, going to back to school. In dengue, it is the other way around. In first 4 days, you have fever, you have body aches, everything. Day 3, 4, 5, the fever settles down. Now the problems start. Pain abdomen comes in, vomiting happens, body starts leaking fluid. So हमारी blood vessels में से fluid leak होके पूरी body में इकट्ठा होना शुरू हो जाता है. So what happens is your blood pressure dips. So you must have heard people talking about platelet count dip होता है. Platelet count dip. People keep talking about no platelet, no platelet, no platelet, no platelet. Whereas actually what is happening is fluid is leaking out, so blood becomes thicker. So if we test, you will find a higher hemoglobin. अगर आपका hemoglobin मान लो 11, 12 है, तो आपको हम जब टेस्ट करेंगे हमें 16, 17, 18 दिखेगा, which tells us that fluid is leaking in the body. Now this fluid, if it accumulates in the liver, you will have pain in the liver. You can have low blood pressure, blood not flowing properly, kidneys getting affected. So multiple organs of the body can get affected. That is the importance of it. So dengue can be a mild, simple infection, or dengue can cause very, very severe infection. Now, why I mentioned किसी भी इंसान को 4 times dengue हो सकता है. First time dengue हुआ, वो normal एक mild infection हुआ और 4-5 days में settle हो गया. Now, if you get a second dengue virus, different strain, your body will react more severely. So second, third, fourth infection, your chances of getting the severe disease increase. डेंगू में सिर्फ इतनी बात याद रखो, आपको और डिटेल्स में नहीं जाने की जरूरत. क्या है क्या नहीं है. इट्स अ वायरस, किसी को भी 4 बार हो सकता है. इट यूजुअली माइल्ड डिजीज, लेकिन कईयों में सीवियर हो सकती है. दैट इज इफ यू हैव हैड अ प्रीवियस डेंगू इन्फेक्शन और आपकी बॉडी अब नॉर्मली रिएक्ट करे. मोस्ट ऑफ द टाइम माइल्ड डिजीज सेटल्ड इन 4 to 5 days. सम विल हैव अ सेकेंड फेज जिसमें डिटेरियोरेशन होती है, जिसमें सिम्टम्स फिर वर्स होने शुरू होते हैं. Hospitalization and all those things are required. Okay? Next. Malaria. Vector. जो वायरस नहीं है, इट्स अ पैरासाइट. इट्स कॉल्ड प्लाज्मोडियम. इसके भी 4 स्ट्रेन होते हैं. वाइवैक्स, फैल्सिपैरम, मलेरिया एंड ओवेरिया. सो हम फीवर के पैटर्न से डिसाइड कर लेते हैं कि किस तरह का स्ट्रेन है. हम टेस्ट से डिसाइड कर सकते हैं कौन सा पर्टिकुलर स्ट्रेन है और इसमें कौन सी ड्रग्स काम करें. Since it is not a virus, it is a parasite. We have drugs available for it. Usually, incubation period is कि आपको मॉस्किटो ने काटा, you can get the infection within 7 to 30 days. ऐसा नहीं है कि आज काटा और कल हो जाएगा. People come, मेरे को बुखार आ गया, कल मुझे मच्छर ने काटा था. One day में नहीं होता. It takes time. Okay. Symptoms आपको हाई फीवर मिलेगा, सीवियर बॉडी एक्स मिलेंगे, चिल्स. पुराने जमाने में बोलते थे कि जिसको हाई फीवर आ रहा है विद चिल्स ये मलेरिया हो. But today's time you see a lot many fevers with chills. So malaria is one of them. Severe body aches, headache and blood hemoglobin drops. ये बहुत characteristic feature होता है. Again, it is vector-borne disease, but a different mosquito. Aedes, Anopheles, इसका भी Aedes mosquito है. But इसका mosquito day में भी काट सकता है, night में भी काट सकता है. It's not like a dengue mosquito जो सिर्फ day में ही काटता है. So night में आपको mosquito काटा है वो most of the time dengue नहीं करता. लेकिन this can happen. Similar type of presentation, fever, body aches, सब जैसे डेंगू होता है सेम प्रेजेंटेशन होती है. ऑल वायरसेस प्रेजेंट सेम, बट इसमें सीवियर जॉइंट पेन. जॉइंट्स हिलते भी नहीं है आपके. बिग जॉइंट, स्मॉल जॉइंट्स, मूवमेंट विल कॉज लॉट ऑफ पेन. फीवर, हेडेक, पेन एब्डोमेन, वॉमिटिंग, ऑल दोस थिंग्स कैन हैपन इन एनी डिजीज. बट हम कैसे डिफरेंशिएट कर रहे हैं? वी आस्क ऑल दीस क्वेश्चंस कि आपको जॉइंट पेन तो नहीं हो रहे, यहाँ पर प्रॉब्लम तो नहीं, ब्लीडिंग तो नहीं हुई. जैसे डेंगू में हम स्पेसिफिकली पूछेंगे कहीं से ब्लीडिंग तो नहीं होगी, हमारा प्लेटलेट काउंट लो है या हमारे प्लेटलेट्स काम नहीं कर रहे हैं तो ब्लीडिंग ज्यादा हो सकती है. इसमें जॉइंट पेन ज्यादा होंगे. मलेरिया में सीवियर वीकनेस होगी, चिल्स होंगे और मतलब पेशेंट जो है वो पेन लगना शुरू है बिकॉज हीमोग्लोबिन ड्रॉप्स. यू नो, सो दीज आर द कॉमन ways we differentiate differently. Right? Now coming on to what is the treatment and what is the prevention. So vector-borne disease है. What is the treatment? Dengue, chikungunya are viruses. No treatment. So जो भी चाहिए supportive care चाहिए. Fever आ गया, पैरासिटामोल ले लो. Plenty of liquids. Good hydration. Rest. Vomiting हो रही है, vomiting की मेडिसिन ले लो. इसके अलावा कोई दवाई नहीं चाहिए. Anti-malarial drugs are available. वहां पर हमारे को टेस्ट की. But more important than that is prevention. Prevent mosquito bites. तो क्या करना चाहिए? Especially rainy season में use mosquito nets, use repellents, wear full sleeves clothes. जहां तक हो सके mosquito bite से बचना. जहां पर पानी इकट्ठा हो रहा है उसको ड्रेन करना है. Don't let it be there. Otherwise, don't think कि आपके एरिया में कहीं क्लॉगिंग नहीं है तो दूसरे एरिया से मच्छर नहीं आ सकता, कहीं से भी आ सकता. So in each and every person in your areas, keep looking for stagnant water and it should be drained. That is more important. Okay, and good hydration. So these are the basic vector model. Now, if we talk about in today's time, dengue है, malaria है, आ रहा है, सब कुछ आ रहा है. Are you aware looking around your house, कहीं water logging है नहीं है? Are you using mosquito repellent? Are you using mosquito nets? All out में आपके होगा. मच्छर काट रहे हैं कि नहीं काट रहे? काट रहे हैं. So then prevention तो आपको ही करनी है. Nobody will come and do it. So that is the whole purpose. You should be aware vector-borne diseases में क्या important. Okay. Now come on to the second part. Is the waterborne disease. Okay. Waterborne disease, food and water. So we talk of typhoid. Now here comes the difference. Typhoid is bacterial, not a virus. So it is caused by Salmonella typhi and paratyphi. This is the strain of the bacteria. Spread through contaminated food and water. Incubation period usually 6 to 30 days. So मतलब आपने आज कुछ खाया, contaminated food लिया, तो ऐसा नहीं है आपका मान लो vomiting हुई, पेट खराब हुआ, loose motion हुए. It can be a simple infection. But if this infection persists day 6, day 7, day 10, so most likely go typhoid. Symptoms, you may have lot many symptoms or you may have just fever. High grade fever, day 2, 3, 4, 5, 6, not settling down, taking treatment, fever not coming down, appetite, खाना देख के उल्टी आती है, pain abdomen, vomiting, loose motions, because it is the intestine. So this is typhoid. And typhoid, it is such a disease, if not curable, it leads to multiple complications. Okay. Next slide. Then comes hepatitis. So typhoid and hepatitis, particularly hepatitis A. Now hepatitis A is typhoid is a bacteria. Both of them presents in the same way. Both of them have similar symptoms. Spread be same, contaminated food and water. What difference? Difference is here the fever will be like a viral fever. 1 day, 2 days, 3 days, fever gone. Now, pain abdomen, vomitings, this will start. Loss of appetite, gone. And jaundice sets in. So, in children, most common cause of jaundice is hepatitis A. और सबसे common reason for getting hepatitis in today's time. Right? अगर मैंने बता दिया ना तो आप लोग सब हिल जाओगे. The most common reason is hepatitis. Maximum cases we see, we get a history that हमने मोमोज खाए थे और हफ्ते बाद ये सब चीजें शुरू हो गई. Contaminated food कहाँ से आएगा? How many of you like golgappas? Raise your hands. Very good. Chaat papdi, samosa, jalebi, momos, pizza. Now, anybody can say samosa तो पूरा fried है, पूरा अच्छे से बना, wouldn't cause infection. Makes sense. Whatever is cooked properly, unlikely to cause infection. But infection कहाँ से आता है? Infection आता है चटनी से. That is contaminated. So your water वहीं use होगा. आपने जो चीज boil कर ली, fry कर ली, things will change. But जहाँ जो चीज fried नहीं है, boiled नहीं है अच्छे से, वहाँ infection के chances. Have you ever gone and seen how these chutneys are prepared? You cannot see it. That is why it is the severe cause of severe. गोलगप्पे से infection नहीं आता, गोलगप्पे के पानी से infection. Got it? So next, third is gastroenteritis, जो सब common है, जिसको हम food poisoning बोलते हैं. आपने कुछ खाया, पेट दर्द हुआ, fever आया, vomiting हुई, 1 day, 2 days, 3 days, everything set up. So this is commonly called as stomach flu. So it can be caused by, if it is caused by a virus, it is called stomach flu. If it is caused by a bacteria, it is called as acute gastroenteritis. जहाँ पर आपको bacterial infection है. Difference, again, viral infections will settle faster. Bacterial infection will need an antibiotic. Okay, and both types of infections में सबसे बड़ी प्रॉब्लम क्या है? वॉमिटिंग एंड डायरिया. ओके, वॉमिटिंग डायरिया हो रहा है. यूजुअल टेंडेंसीज कैसे रोकेंगे वॉमिटिंग डायरिया को? क्यों हो रहा है वॉमिटिंग डायरिया? व्हाट इज द सिग्निफिकेंस ऑफ वॉमिटिंग एंड डायरिया?
Loss of fluid.
Yes, so if you are having profuse watery diarrhea or you are having repeated vomitings, you are losing water out of the body. Then what will happen? You'll tend to get dehydrated, right? So, what if we stop the loose motion? What will happen? Anybody? People say 5 loose motions हो गए, 10 loose motions हो गए, weakness आ रही है, ये हो रहा है, वो हो रहा है, उठा नहीं जा रहा. दवाई दे दो loose motion रोको, दवाई दे दो loose motion. We do this thing, right? What will happen if we stop the loose motion? If I give a medicine and next within 2 hours no loose motion, what will happen? So understand, vomiting and loose motions, they are body's natural defense systems to clear the infection. So अगर डायरिया हो रहा है, whatever virus or bacteria is coming out of the body, you stop the loose motion, the virus and bacteria will remain inside and will spread, will cause more severe problems. So the answer is we never stop loose motion. Whatever is coming out, let it come out. But it should be adequately replaced. So means there should be no vomiting. Got it? इतना समझना जरूरी है. Vomiting रुकनी चाहिए so that you keep replacing the fluid. Now, in diarrhea, what is happening is your intestinal movement is very, very fast. You drink a glass of water and a glass of water कितना ही stool निकल जाएगा. So the answer is whatever you need to take should be small quantity, more frequent. Sips of water, ORS, lassi, soup, छाछ, whatever. थोड़ा small quantity is more frequent. So small quantity, your tendency to vomit will be less, diarrhea will be less, weakness will be less, recovery will be faster. Hydration will be good. Then most of the children say कि मेरे को ये पसंद नहीं है, मुझे वो पसंद नहीं है, plain पानी देते जाओ. That is the biggest cause of weakness because whatever you are losing is with salts. If you replace it with plain water, you will tend to get weak. तो अगर आप जितना फ्लूइड लोगे विद सॉल्ट लोगे, ORS ले लिया, लस्सी ले लिया, सूप ले लिया, what we need to avoid is high sugary drinks. So we say don't take juices, tea, शरबत. ये you have a glass of water, that is homeless. आप घर में बनाते हो रोटी. Sips of water and keep monitoring the urine. यूरिन अच्छे से पास हो, there is no dehydration. अगर यूरिन नहीं पास हो रहा है, बहुत लॉन्ग गैप्स आ रहे हैं, means the other side to look at is you start feeling. So लग रही है means dehydration setting हो रही है. Increase your liquid intake, but small quantity, more. Got it? Next slide. Cholera. Again, अब कम देखने को मिलता है. So there was one time when this is one infection. It's a bacterial infection. It is caused by a bacteria called Vibrio cholerae. This is one type of infection which can cause severe diarrhea. मतलब the water flows out of the body in liters. Within minutes you get severe dehydration. Within minutes आपके पास उतना रिप्लेसमेंट का टाइम ही नहीं है. अब सोचो आप एक बारी में 1 लीटर पानी नहीं दे सकते ना. वहां तो मतलब हर 10 मिनट में 1 लीटर पानी देना जा रहा है. That profuse diarrhea. So this is one infection which spreads through contaminated food and water, and it can cause epidemics. जैसे स्कूल में एक तो हुआ, सारे बच्चों को एक साथ होने से मिल जाए. It is that severe. But yes, with improved hygiene and everything, we see much less. But this is one infection. इसका incubation period बहुत छोटा है. 2 घंटे आपको भी infection लगा, 2 hours में डायरिया शुरू. And इसका जो सबसे important feature है, right? The water which comes out is not a yellow fluid or a green fluid. It is rice water. White fluid निकलता है. और जहां हमारे को दिखता है सीवियर डिहाइड्रेशन होती है, बहुत हाई वॉल्यूम फ्लूइड लॉस हो रहा है और राइस वाटरी स्टूल है, हमारे दिमाग में खटा जाता है ये कॉलरा. दिस इज हाउ. नेक्स्ट स्लाइड. लेप्टोस्पायरोसिस. अगेन दिस इज a particular type of infection. It's also caused by bacteria. This happens because of the food or water contamination by animals' urine. So Leptospira जो है ये bacteria है which is mostly in the animals. So आपके dogs, cats, buffalo, इनका उसके आसपास you will tend to get patient this bacteria. यहाँ से Spira आने के चांस. Which is this is one infection जिसमें मतलब pain abdomen, vomiting, diarrhea. So all food water related diseases will present with pain abdomen, vomiting, diarrhea, fever. इसके अंदर severe liver involvement, jaundice आएगा, your liver, your kidneys can fail. So this is one infection which can be very, very severe. It's a bacterial infection. It has a treatment. Antibiotics are there. We need to make the diagnosis and treat. Okay. Right. So now, what is the treatment? So I explained to you. Hepatitis A is a virus. No treatment. So treatment is mainly supportive. Typhoid, cholera, leptospira. These are all bacterial infections. इनके लिए antibiotics available है, but specific antibiotic is required. So antibiotic is not like any antibiotic will work on any bacteria. No. So we have to be specific. We need to make a diagnosis and then treat accordingly. Okay. Now comes the important role. What is the prevention? हमें पता है contaminated food and water. Rainy season, high chances of contamination. सब जगह पानी इकट्ठा हो रहा है. So what is the prevention? Use boiled water or RO water. ठीक है. One, wash your fruits and vegetables. कभी आपने देखा घर में parents fruits and vegetables wash करते हैं? ठीक है ना? So it is for this reason, because contamination वहां से. Avoid eating outside food. ये सबसे important है. At least, especially during rainy season, जब आपको पता है इस time में infections, ये वाली infection, waterborne, वो आप घर में बना के खा लो. But getting it from the outside and or eating outside, high chances of contamination, getting it. Okay. And typhoid, cholera, hepatitis A, these are the diseases against which vaccination is available. I am sure you must have all got these vaccines. Even organization schedule में है, but at least now you are big enough, you can go and check. कि आपको जो वैक्सीन लगे, कॉल टाइफाइड वैक्सीन लगाओ कि लगाओ, हेपेटाइटिस ए का वैक्सीन लगाओ कि can go and check. Okay. Coming on to the third part, that is the airborne disease. Airborne diseases, to remember, very easy, is like COVID. COVID कैसे spread हुआ था? Airborne, through droplets infection. So इसमें common cold, flu, influenza, this is the common infection which will happen during this period. So while most of these are viral infections, droplet spread, incubation period is very short, 1 to 2 days. You will have symptoms, fever, cough, cold, running nose, malaise, sore throat. 1, 2 days, 3 days, and everything settles down. You may have red eyes. So these days we are seeing a lot of eye flu. So this is again virus. How we differentiate between a viral and a bacterial infection? If you have an eye flu, your eye will be red. But if you have a lot of discharge, eyes चिपक रही है, पस आ रहा है, that is a bacterial. So if you look at these days, you just see lot of red eyes, no itching, no discharge, just watering, 1 day or 2 day of fever, and third day everything settled. Okay, so that is eye flu. Next slide. Influenza. Influenza is again, it's a virus with a specific name like COVID. COVID virus है, ऐसे influenza virus. Just like you saw COVID epidemic, influenza is known to cause epidemic. This is the first virus जिसका epidemic start हुआ था in 1912. It was influenza pandemic across the world. So lakhs of people died. इस वायरस की बहुत कैरेक्टरिस्टिक फीचर है, इट चेंजेस इट्स स्ट्रक्चर. तो आज फ्लू वायरस लगा है, नेक्स्ट सीजन में वो फ्लू वायरस दोबारा आ जाएगा विद अ डिफरेंट शेप. बॉडी कैन नॉट आइडेंटिफाई. So that's why you get frequent infections with influenza virus. And this is one compared to common, but this can cause severe disease. Chest involvement, pneumonia, infection इससे ज्यादा होने के चांस. And for this, prevention is available. Vaccine is available for influenza. So common cold, there can be n number of viruses. So we don't have vectors, but जिसके लिए है बहुत frequent हो रहा है. Kids who are allergic, we always advise them to take like so. But treatment again, I think this all of you have seen these things happening. So if you have cough and cold, cover your mouth, face with sneezing or coughing, cover your nose and mouth. Preferably wear a mask. If you have cough and cold, please avoid coming to school. आप आओगे तो और चार को मिलेगा. It spreads like okay. Then wait for infected. Use of hand sanitizer. So अगर आप लिफ्ट में हो, close ventilation, तो टीका पूरी क्लास को मिलता है. So this is how it's spread. So what is the prevention? These are the important points. And flu, so we have these which will happen during this and prevention, and you should be able to understand कि मेरे को ये प्रॉब्लम हो रही है, मुझे एटलीस्ट घर में क्या करना. Okay, coming on to the last part, you should all understand what are the dangers. Commonly हम घर में देखते हैं, at least our generation, people are still not that aware. 101 fever, 102 fever, okay, not that. 104 fever, 105 fever, something emergency. Bhag hospital, everything does like this, right? Remember, viral infections, high fever is very, very common. So high fever 103, 104 तक गया, but medicine से उतर रहा है. Fever down होने पे you feel fine, no pain, no vomiting, खाना खाने को भी मन कर रहा है. Very high fever, not settling down, repeated vomiting, you are not even able to take water, is an emergency. Passing less urine is an emergency. Child becoming drowsy, fever है, you feel dull, you feel want to sleep, आप सो रहे हो ठीक है. Fever down हुआ, still you are dull, you are not wanting to get up, you are not wanting to eat, means there is a problem. Hand, feet, no fever, but hand feeling sea cold is an emergency. You are feeling difficulty in breathing. You are going to make an effort. सांस लेने में दिक्कत लग रही है, is an emergency. Beyond this, अगर आपको फीवर, वॉमिटिंग हुई, डायरिया हो रहा है, मेडिसिन से वॉमिटिंग रुक गई, nothing to do. At least keep taking liquids. Right. So coming on to the last part, the last slide. General health tips. क्या करना है? Keep yourself well hydrated. This is one thing. Plenty of liquids. Water. You should be a good amount of urine. One. Good personal hygiene. Hand wash. There is no substitute to hand wash. You can use hands and everything. That it should be with you. But before food, after food, going out, shaking hands with someone, at least if you're coming back home, wash your hands. Wear full sleeve clothes. Okay? Eat a balanced diet. Especially जब पता है इस पीरियड में बीमारियां ज्यादा आनी है. You should focus on high protein diet. Lots of fruits, lots of vegetables, low fat diet. Less sodium. Try and possibly avoid junk food during the season. So your pizzas, your Maggi, pasta, they have very, very high sodium content and fat content. So they tend to cause more problems. Then avoid outside food. Good sleep hygiene. This is one problem which we say, जहाँ आपके sleep proper नहीं है और आपकी sleep scheduled नहीं है, your body immunity tends to low. So when we say scheduled sleep means you sleep well in time at night. जो कि आजकल प्रॉब्लम है विद स्क्रीन टाइम रात को 10, 11, 12, 1 तो नॉर्मल बच जाता है छुट्टी वाले दिन. So you sleep late, you get up late. You say, I have done 7 hours of sleep. That is not important. Important is your sleep cycle. वो timing में important. You may sleep 10 hours in a day. आप रात को लेट सोए 3 बजे सोए और सुबह 10 बजे उठे या 11 बजे उठे 12 बजे उठे. That is not good sleep hygiene. That your body tends to go low on it. And good physical exercise. So at least 45 to 60 minutes of regular exercise every day is required for everyone. Okay? Thank you. Any questions you have? किसी की कोई क्वेश्चन नहीं है? समझ आ गया या किसी ने कुछ सुना ही नहीं?
तो मुझे लगता ही नहीं है कि कोई ऐसी चक्रा में ध्यान में पूरा कोई ऐसी चीज छोड़ी ही नहीं आपने क्योंकि इन दिनों में ये सारी चीजें हो रही है और बहुत अच्छा लगा.
No, I didn't say that.
I नहीं जानते.
So आप पेट्स रखते हो, आप पेट को बाहर लेके जाते हो, वो बाहर जाएगा तो पेट कहाँ मुंह चलाएंगे किस तरह they can carry the infection. So their urine and stool can be contaminated. So normally what happens is कि हम पेट को उठा के गोद में भी करते हैं, we do wiggle with them, वो पेट में भी आएंगे, सब कुछ होगा. बट उसके बाद क्या हम अच्छे से हैंड वॉश के बारे में सोचते हैं? खाना खाने गए तो पेट में खाना आ गया, पेट भी साथ में बैठा हुआ, आपने खाना खा लिया. So that is not. So he would say don't keep pets. At least you should.
Sir, you said there is a vaccine available for influenza, but it changes its mutations and structures fast. So, how is there a vaccine available for?
So every year, based on the strain which is prevalent in that particular season, the vaccine is made. So influenza is one vaccine which has to be every year. So it is not one. So जब भी होगा आपको. So in any way, vaccine is for prevention. So vaccine is 100%. Of you must have taken COVID. COVID happened. The purpose is that it reduces the severe complications covered. Similarly, for vaccine is available. Typhoid vaccine used to be given every 3 years, but फिर भी टाइफाइड होता है. But जो complicated टाइफाइड हम 30 years पहले थे, वो आज नहीं थे. That is all.
Namaskar, sir. So there is a mosquito Culex. Sir, it causes the disease elephantitis. So does the mosquito produce the bacteria or does it pick it up or something?
So it is a vector. So again, say Anopheles got infected with the malarial parasite. मतलब it bites one person, इसको malaria था. Now this mosquito bites the other person gets fever. Similarly, dengue is caused by a virus which is infected with the dengue virus. So this mosquito bites one person. This is how it is. You have dengue. You cannot spread it to your friend. कि मैं उसके साथ खाना खा लिया, उसको टच कर लिया तो उसको डेंगू हो जाएगा. नहीं होगा. Vector-borne diseases will be transmitted by a vector.
And so why is it that it usually affects the lower part of our body, elephantitis?
So elephantitis is a totally different problem. So this mosquito carries the particular bacteria which causes elephantitis. So what happens is that these bacteria, they grow very fast and they block the particular blood channels. These are called as lymph channels. So हमारा blood जो है arteries में flow करता है away from the heart to the body और veins के through वापस आता है. But there is another channel which is called as lymph channel, which उस हमारा जो fat वाला component होता है वो travel. So if those channels get blocked, तो हमारे particular lymph के अंदर blood supply mismatch होती है. तो ब्लॉकेज की वजह से स्वेलिंग आएगी, पेन होगा एंड विद पीरियड ऑफ टाइम वो पर्टिकुलर मसल्स जो है फैट है वो ग्रो करता है. तो बोलते हैं होता कि ब्लड सप्लाई ग्रो. So that is a very very specific disease with very very specific signs and symptoms.
Thank you, sir.
Namaskar, sir. I have a doubt. So I want to ask the bacteria whether it affects the protein factors in the blood, like
You look at the particular or what happens is when the infection comes in beyond certain limits, suppose that now certain reactions start happening in the body. So your thing. So what happens? Blood pressure. Your blood sugar we try to detect. So how will the body do it? So that the blood is उसको ज़्यादा pump करना पड़ेगा. If things go beyond limits, जब तक बॉडी कॉम्पेंसेट कर रही है तो ठीक है. जब कॉम्पेंसेट नहीं करेगी तब मल्टीपल ऑर्गन इफेक्ट शुरू होते हैं. So blood again is an organ. So beyond limits, जब blood वाला component है, जब इफेक्ट होगा तो इस clotting factors, coagulating factors सब यूज हो जाएंगे बॉडी में. तो blood के अंदर clots बनते हैं. These clots will go and block the small vessels in the body. एक तो clotting factors खत्म हो गए, कहीं से भी bleeding होगी तो रुकेगी नहीं, वो कंटिन्यूस चलती रहेगी. और प्लस और गर्ल्स की ब्लड. So this is how the disease is treated. उसके अकॉर्डिंगली हमारे इन्वेस्टिगेशन बने टू फाइंड आउट एंड ट्रीट दैम.
Please, I say that parents are, he's one of the illustrious parents. His two kids were there, Avni and Nilay. Now they are being so passed out. And but we can never forget Monday, Wednesday, Friday, 3 days he was here. How to sanitize lab equipment, how to wear a mask, how our conservancy staff, our admin staff. Very rarely we come across such parents who are asset for the institution. So he is one of the valuable asset for ITM and for everyone. So I always welcome parents who can contribute in always because I flu, stomach flu, and typhoid cases. Today, I think I have signed 10 applications. And one request is that if you are having some symptoms, red eyes, yeah, itching eyes, don't come to school. Don't worry about class test and PT test. We'll take care of your studies and test can be taken another time. So I saw a lot of parents, especially 6, 7, 8. You know, parents are coming with the children that exam था health पहले देखना है कि ये 10 मार्क की exam is important for you and think about others.
I would also want to mention one point. So whenever you are writing, even the stomach flu, an application is coming. So you should now understand. Now everybody knows how to. So go off 2-3 days. Typhoid will go for long. मुझे टाइम गया और थर्ड आ गए
That's medical certificate also. But these days, medical certificates are very easily available. Be aware. I go to the label. You remember? One child wrote medical, which I did not believe that it is correct. I called up the doctor and said that this is your clinic and your signature. I find it is fraud because the child was somewhere out with the parents on vacation. How could you sign? The doctor was really so apologetic and said that एक family friend है and आके बताया तो मैंने कर दिया था. I said don't do this again. He never believed that the school principal can call a doctor to find out whether it is correct or not. But I had the information that the whole family was out on vacation and there was some exam or something and medical आ गया. So ये करने की तो बिल्कुल सोचो ही मत because I know what to do. And so if you are ethical, follow ethical practices also. Got it?